my name is Jennifer Idora. I am the police reporter in Chapter 2, Lesson 1, The Physical and Sexual Self. Lesson Objectives. Discuss the developmental aspect of reproductive system. Number 2, discuss the erogenous zone. Number 3, explain human sexual behavior. Number 4, characterize the diversity of sexual behavior. Number 5, describe sexually transmitted disease. And number 6, differentiate natural and artificial method of contraception. Karamihan po naniniwala sila na nakadepende sa sex chromosome ng tao ang pagiging lalaki o babae. Ano nga ba ang sex chromosome? Ito po yung form, size, and behavior ng isang tao. Yung ibang tao po kasi, hindi nila tanggap kung ano yung innate sexual characteristics nila o yung totoong gender na meron sila pagkapanganak pa lang sa kanila. Kaya nagpapapalit sila ng sexual organ through medication or kaya naman nagpapa-opera sila. Maria P.N. 2001 explained that the gonads, reproductive glands that produce the gametes, testes, or ovary begin to form until about 8 weeks of embryonic development. During the early stage of human the embryonic reproductive structure of male and female are alike and are said to be in different stages. Kapag po ang primary reproductive structure ay nag-form, magsisimula na po ang development ng accessory structure at ng internal genitalia. Nakadepende po kasi sa testosterone ng formation ng male and female structure. Ano nga ba ang testosterone? Ito po ay ang sex hormone na kumukontrol sa sexual development ng isang tao, lalo na sa mga kalalakihan. Nagpo-promote din po ito ng secondary sexual characteristics katulad ng pag-increase ng muscle, bone mass, and growth of body hair. So, ayun, kapag nag-form na po ito at nag-release na ng testosterone ng embryonic testes, ang formation naman po ng duct system and external genitalia ay ang susunod na mag-uumpisang mag-form. Any intervention with the normal pattern of sex hormone production in the embryo results in strange abnormalities at nagre-result po ito na tinatawag na pseudo-hermaphrodite at hermaphrodite. Pseudo-hermaphrodite are formed who are individuals having accessory reproductive structure that do not match their gonads. Halimbawa po dito sa lalaki may testes siya but he has complete female phenotype. Or makikita mo sa appearance, development, and behavior niya na dapat nasa part lang ito ng babae ng isa. Hermaphrodites are individuals who possess both ovarian and testicular tissues but this condition is rare in nature. Ito naman po ay may same-sex organs ng tao, kaya din po nitong mag-produce ng gametes galing sa babae at lalaki. May tinatawag na cryptorchidism kapag nag-fail ang development ng reproductive organ. Itong condition po na ito is usually tumatama sa mga batang lalaki at posibleng magkaroon sila ng cancer sa testes o tinatawag na sterility. Matanggal po ito through surgery habang bata pa lang para maalis yung sakit sa batang lalaki. Yung ibang abnormalities condition naman po, kapag ang bata ay may isang sex chromosome, kung sa babae ay XO, ito ay normal at kulang ito sa ovaries. Kapag naman po sa lalaki ay YO, namamatay ito during development pa lang. Phimosis, other serious conditions also affect males primarily, such as phimosis, which is due to narrowing of the foreskin of the male reproductive structure and misplaced urethral openings. Phimosis po ito yung nagpapakito sa foreskin para maipilig sa pinakahead ng penis. Ito ay normal sa mga babies and toddler pero sa older children ay magre-resort ito ng skin condition known as the period of life. Kung ang reproductive organ ng tao ay nag-grow to adult size at nag-function under the rising levels of gonadal hormone, tinatawag po ito na testosterone sa lalaki at estrogen naman po sa babae. Pagkatapos nito mag-function, nagpapatuloy naman ito hanggang sa tawagin na old age sa lalaki at menopause naman po sa babae. Lahat ay nagbabago during puberty, pero at the age of 13 po, nagbabago din ang reproductive organ ng tao, pati na rin ang appearance ng hair in pubic area, axillary, and the face. Ang reproductive organ ay nag-continue mag-grow 2 years until sexual maturation by the presence of mature semen in the testes. Sa babae naman po, ang paglaki ng breast o dibdib at the age of 11 in the puberty stage. Menarche ang tawag sa first menstruation ng babae at nangyayari ito 2 years after mag-start ng puberty niya. Pinaka-importanteng role po ng sa babae ang hormones pagdating sa regulation ng ovulation and fertility nito. means associated with the reproductive system. Infection is the most common problem associated with the reproductive system in adults. May mga disease po na nakikita sa reproductive system ng babae at lalaki lalo na sa mga adults. Ang vaginal infection naman po ay common para sa mga babae lalo na sa mga may hina ang resistensya pagdating sa mga disease. Si E. coli ang usual infection na tinatawag sa mga babae through digestive tract and the sexual transmitted microorganism such as syphilis, gonorrhea, and herpes virus. Pati na rin po ang least type of fungus. Abnormal menses is also one of the symptoms na may infection or hormone imbalance ang babae. Sa lalaki naman po ang common inflammatory condition or prostatitis, urethritis, and epididymitis. All of these which may follow sexual contact in which sexually transmitted disease or STD microorganism are transmitted. Orchitis or inflammatory of the testes, it can cause sterility or cancer po sa testes. Most commonly follow mumps in an adult males. Neoplasms are the major threat to reproductive organ. Tumor of the breast and cervix are common reproductive cancer po para sa mga babae at prostate cancer naman para sa mga lalaki. Nangyayari ang ganitong condition o reproductive ability simula po 20 ang babae. Madami po ang nababago sa babae kapag nag-stop ang menstruation nito. Pwedeng mag-dry ang vagina ng babae at sasakit ito kung nakikipag-intercourse. And vaginal infection increasing by common, maaari din kung magkaroon ng depression, pag-dry ng skin at slowly rising blood cholesterol level. Sa mga lalaki naman po, is walang problema dahil kahit nasa 80s na sila, kaya pa din po nito magkaanak basta healthy at walang sakit ang male. Erogenous zones refer to parts of the body that are primarily receptive and increase sexual arousal when touched in a sexual manner. Ito po yung part ng katawan ng isang tao na kapag nakahawakan is tumataas yung sexual arousal and nataturn on ito. Ito po yung part ng katawan ng tao na kilala bilang erogenous zones: bibig, dibdib, genitals, and anus. Yung iba naman po, mas gusto nila na hinahawakan sila sa mga area na mabilis sila ma-turn on. Ito po ay sa neck, sa hita, sa abdomen, at sa paa.
Hi, my name is Gabriel Martin, and ngayon tatalakayin natin kung ano nga ba ang ibig sabihin ng human sexual behavior. Human sexual behavior, human sexual activity, human sexual practice, or human sexual behavior is the manner in which human experience and express their sexuality. Types of behavior. 1. The solitary behavior, involving one and only individual. When we say solitary behavior, a sexual act by a single person, usually in private, often understood to mean masturbation. Number 2. Socio-sexual behavior, involving more than one person, including male and female. When we say socio-sexual behavior, commonly happening nowadays, other teenager early experience sexual activity that should be married first before intercourse. Yung mga kadalasang nangyayari sa mga kabinataan at kadalagahan na may maagang nabubuntis dahil sa nakakaranas ng socio-sexual behavior. And the third one is the homosexual behavior. Male with male, female with female, involving 3 or more individuals are involved. When we say homosexual, ito ay pakikipagtalik sa kapwa babae o sa kapwa lalaki. Sociology of human sexual behavior. Number 1. Excitement phase. It is caused by increasing blood pulse and blood pressure, a sudden rise in blood supply to the surface of the body resulting in increased skin temperature. Ang excitement phase, ito ay kadalasan na nararamdaman ng isang tao kapag siya ay makikipag-intercourse sa kanyang kapartner. Number 2. Plateau phase. It is a generally brief duration. Its self-stimulation orgasm usually occurs in the middle of sex activity. Orgasm is normal while doing an intercourse. Sexual climax. It is marked by feelings or abrupt in intense pleasure and rapid increased pulse rate and blood pressure and spasm of the pelvic muscles causing constrictions of the female reproductive organ. Ito ay nararamdaman ng isang babae na sumasakit ang kanyang vaginal part after nitong makipag-intercourse sa kanyang kapartner. Last, resolution phase. It is the last stage that refers to the return to a normal or subnormal physiologic state. Male and female are similar in their response sequence.
Hello guys, my name is Bart Aaron Giban. Ang topic ko po ay nervous system factors. The entire nervous plays a significant role during sexual responses. In the presence of a stimulus capable enough of initiating a sexual response, different cerebrospinal nerves transmit the sensory message to the brain. After interpretation and integration of sensory input, the efferent cerebrospinal nerves receive commands from the brain, send them to the muscles and the spinal cords, serves as a great transmission cable. Ang ating central nervous system ay binubuo ng brain at spinal cord. Ito ay tinaguriang central dahil ito ay binibigay signal o impormasyon sa buong katawan, pati na rin yung mga coordinates, activity ng ating mga organs. Next page. The muscle contact in response to the signal. The muscle contact in the response to the signal coming from the motor nerve fiber while glands secrete their respective products. Pain sexual response is a different on the activity of the nervous system. Merong 3 major muscle types na natatagpuan sa ating human body. Ito ay ang skeletal, cardiac at smooth muscle. Lahat ito ay may iba't ibang katangian gamit components and pathology. Una, skeletal muscle. Ito ang organ na nagkokontrol ng galaw at posture ng ating katawan. Pangalawa, ang cardiac muscle na nasa ating puso na nagsisilbing ang ating buhay. Pangatlo, smooth muscle, manna, na natatagpuan sa gastrointestinal, tiyan, reproductive, urinary, vascular at respiratory system ng ating katawan. Meron din tayong glands sa ating katawan na nag-secrete o nagpo-produce ng different enzyme na kailangan ng ating katawan. Ang ating sexual response ay nakadepende sa ating isip. comprised by a largest category. They are usually caused by socially induced inhabitations, maladaptive attitudes, ignorance, and sexual might help in society. Example of letter: good mature sex most involve rapid erection, prolonged coitus, simultaneous orgasms. Premature emission of semen is a common problem, especially for young males. Erectile impotence is almost always of physiological origin in males under 40. Ejaculatory impotence, which result from the inability to ejaculate in coitus, is uncommon in its usually of physiogenic origin. Vaginismus is a strong spasm of the pelvic musculate constricting the female reproductive organ so that penetration is painful or impossible. Social category ay isa sa malaking epekto ng ating sexual problem. Ito ay nagdudulot ng di magandang katangian sa ating tao at maaaring magbigay ng panganib sa kung sino man. Ito ay gawa ng makamundong komunidad ng ating henerasyon, kaya dapat tayo ay maging maingat at di magtanga-tangahan. Sexual transmitted diseases. Sexual transmitted disease STDs are infection transmitted from an infected person to an uninfected person through sexual contact. It can be caused by bacteria, viruses, or parasites. Sexually transmitted disease ay isang sakit kung saan ay ito ay nakukuha sa pamamagitan ng pakikipagtalik ng isang infected o mayroong STD sa walang STD. Ito ay pwedeng makuha sa mga bacteria, viruses, at parasites. STD are a significant global health priority because of their overwhelming impact on women and infants and their interrelationship with HIV and AIDS. Infections with certain STDs can increase the risk of getting and transmitting HIV as well as modify the way the disease develops. STD can be lead to long-term health program, usually in women and infants. One of the leading STD world is AIDS, which is caused by HIV or human immunodeficiency virus. Ang sakit na STD, isa sa mga sakit na tinututukan ng ating World Health Organization sa kadahilanan ng maraming mga kababaihan, bata at sinapupunan ang nagkaroon ng HIV and AIDS. Ito ay lubos na kinakabahala ng maraming doktor sa ating bansa at sa buong mundo dahil maraming tao, bata man o matanda, ang nagkakaroon ng sakit na STD. Ang sakit na STD ay isang mahabang gamutan. Ang kinakailangan ng iba yung pag-iingat at pangangalaga ng sarili. Kadalasan ng mga kababaihan at mga bata ang madalas na magkaroon. AIDS ay isa sa mga leading o nangungunang nasakit na STD. Ito ay sanhi ng HIV or human immunodeficiency disorder. The virus usually targets the T cells, SD4 cells of the immune system, which serve as the regulators of the immune system. The virus surveys through a body but may be transmitted via body fluids such as blood, semen, vaginal fluids, and breast milk. Inaatake ng virus ang T cells, CD cells ng ating katawan. Ito ang nagsisilbing panlaban natin sa ating human system. Ang virus ng STD ay maraming kumakalat sa iba't ibang bahagi ng ating katawan via body fluids tulad ng dugo, semen, vaginal fluids, and breast milk. Aside from HIV and AIDS, there are other sexual transmitted diseases in human. Number 1, chlamydia. It can cause serious permanent damage to a woman's reproductive system. This can make it difficult or impossible for her to get pregnant later on. Chlamydia can also cause a potentially fatal ectopic pregnancy that cross out the womb. Gonorrhea that can infect both men and women. It can cause infection in the genitals, rectum, and throat. It is a very common infection, especially among young people aged 15 to 14 years. Gonorrhea o tulo, sakit na maaaring maapektuhan ang lalaki o babae man. Pwede magdulot ng infeksyon at genitals, maselang bahagi ng katawan ng isang tao, rectum o kuyukot, at throat, lalamunan. Ito ay madalas na infeksyon sa kabataan, edad 15 years old to 24 years old. Syphilis is a bacteria infection usually spread by sexual contact. This disease starts as a painless sore, typically on your genitals, rectum, or mouth. Syphilis ang buwang sakit sa pagkakagit ng isang may syphilis at walang syphilis. Ang sakit ay kadalasan ng nagsisimula sa walang sakit, kirot na singaw o sugat na nakikita sa genitals, rectum, at mouth. Some kirot is caused by infection, disease, with the bacterium. Hemophilus, Blockreal, manifestation include genital occurs and humanal lymphadenopathy or bowels. Sample ito ay infeksyon na nagdudulot ng bacteria at Hemophilus Blockreal. Nagkakaroon ng sugat o nana o pus na nakakatali o silang bahagi ng katawan ng isang babae o lalaki. Human papilloma virus. It's the most common sexually transmitted infection. HIV usually harms and goes away by itself, but some types can lead to center or genital parts. Human papilloma virus. Ito ay pinakakaraniwang sexually transmitted disease. Ang HIV ay karaniwang gumagaling ng pusa o namawala. Pero meron din tsansa na ito ay nauuwi sa cancer o genital parts. This simplex virus are categorized into the two types, herpes type 1, HSV 1 or oral herpes, and herpes type 2, HSV 2 or genital herpes. Most commonly, herpes type 1 was transferred from the mouth and lips, sometimes called fever, distal or sorrow, which is one type of genital herpes type 2.
Good morning everyone, my name is Mary Joy P. Igbalik. My presentation is all about sexual problem and natural and artificial methods of contraception. First is sexual problem. Sexual problem may be classified as physiological, psychological, and social origin. Physiological problems are the least among the three categories. Only a small number of people suffer from diseases that are due to abnormal development of the genitalia or that part of neurophysiology controlling sexual response. Physiological means lack of sexual desire or interest in sex or inability to feel excited during sexual activity. Psychological problems comprise by the far largest category. They are usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, and sexual myths held by society. Psychological, that includes relationship problems, feeling of guilt, depression, concern about sexual performance, or could be the effects of the post-sexual trauma. Premature emission. Premature emission of semen is a common problem, especially for young males. Sometimes this is not the consequence of any psychological problem but the natural result of excessive tension in a male who has been sexually deprived. So premature emission occurs when a man ejaculates sooner during sexual intercourse than he or his partner would like. Next is erectile impotence. Erectile impotence is almost always of psychological origin in males under 40, in older males. Physical causes are more often involved. In other cases, the impotence may be the result of disinterest in the sexual partner, fatigue, and distraction because of non-sexual worries and intoxication. So itong erectile impotence happens when a man is regularly finding it difficult to keep hard enough erection to have sex. Ejaculatory impotence, which result from the inability to ejaculate in coitus, is uncommon and usually psychogenic origin. It appears to be associated with ideas of contamination or with memories of traumatic experiences. Ejaculatory impotence simply means that a male can achieve an erection but not an orgasm. This kind of impotence is usually caused by emotional problems. Vaginismus. This is a strong spasm of the pelvic musculature constricting the female reproductive organ so that the penetration is painful or impossible. It can be due to anti-sexual conditioning or psychological trauma that serves as an unconscious defense against coitus. This means when the muscles of the woman's vagina squeeze or spasm when something is entering, like a tampon or a penis. It could be a quiet, uncomfortable, or painful for women. Next is natural and artificial methods of contraception. Natural method. A is abstinence. B. Calendar method. C. Basal body temperature. D. Cervical mucus. E. Symptothermal method. F. Ovulation detector. And G. Coitus interruptus. Natural method. The natural family planning methods do not involve any chemical or foreign body introduction into the human body. People who are very conscious of their religious beliefs are more inclined to use the natural way of birth control, and others follow such natural methods because they are more cost-effective. Abstinence. This natural method involves refraining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. It is considered to be the most effective way to avoid STIs or sexual transmitted infections. Abstinence is the simplest form of birth control, simply choosing do not have sex so that the sperm can fertilize an egg. Therefore, pregnancy will not occur. Calendar method. This method is also called as the written method. It entails withholding from coitus during the days that the woman is fertile. The woman needs to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent conception. Calendar method. When woman tracks their natural cycle of fertility and menstrual cycle to detect ovulation. Basal body temperature. The basal body temperature or BBT indicates the woman temperature at rest before the day of ovulation and during ovulation. BBT falls at 0.5 degrees. It increases to a full degree because of progesterone and maintain its level throughout the menstrual cycle. This serves as the basis for the method. The woman must record her temperature every morning before and any activity. By this basal body temperature, ovulation can be tracked through body temperature. Basal body temperature can increase minimally when you're ovulating. Women at their most fertile in the 2 or 3 days prior to his temperature increase. Cervical mucus method. The change in the cervical mucus during ovulation is the basis for this method. During ovulation, the cervical mucus is copious, thin, and watery. It also exhibits the property of spin bulky, wherein it can be stretched up until at least 1 inch and is slippery. The woman is said to be fertile as long as the cervical mucus is copious and watery. Therefore, she must avoid coitus during those days to prevent conception. This method relies on tracking the changes in a woman's cervical mucus to plan the best days to have or avoid sexual intercourse. Symptothermal method. The symptothermal method is basically a combination of BBT method and the cervical mucus method. The woman must record her temperature every morning and also take note of changes in her cervical mucus. She should abstain from coitus 3 days after a rise in her temperature or on the 4th day after the peak of the mucus change. Symptothermal method works by recording daily observation of the woman's fertility. Ovulation detection. The ovulation detection method uses an over-the-counter kit that requires the urine sample of the woman. The kit can predict ovulation through the surge of luteinizing hormone or LH that happens 12 to 24 hours before ovulation. The ovulation detection home tested used by women that helps determine a woman's ovulation. The test detects a rise in luteinizing hormones in the urine. A rise in this hormone signals the ovary to release the egg. Coitus interruptus. The coitus interruptus is one of the oldest methods that prevent conception. A couple still goes on with coitus, but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the female reproductive organ. A disadvantage of this method is the pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. Coitus interruptus, or in other terms, pull-out method, in which a man withdrawing the penis from the vagina and away from a woman's external genitals before ejaculations to prevent pregnancy.